It's time for the Dane by Local podcast, Let's Get Local. Each month, we'll feature DBL members and hear their stories. So let's jump into our next episode.
Welcome back to the second episode of Let's Get Local. Today I'm joined by two people that I'm very happy to have by my sides, and that is the wonderful folks from GHC, Mike and Emily. So, Mike and Emily, thanks for coming on today.
Thanks for having us.
Yeah, you're welcome.
All right, so in this second episode, we're going to take a little bit different format. Our first episode was really highlighting a number of the nonprofits and members of Dane by Local that have been longtime members. Moving forward, we will take a different approach, and we're going to feature an individual member for each episode. So today is GHC, and there's a lot of great stuff about GHC. It's one of my favorite nonprofits in the area. I will disclose that right off the top. And we're going to learn all about it from these two. So first off, I want to know, Mike, tell us a little bit about the history of Group Health Cooperative and how it all got started and how it grew to what it is today.
Sure. That's a good question. And we were actually the first HMO in Dane County, started almost 43 years ago. And it just started out for a few years in the early 70s where consumers really wanted to have a different way of providing and delivering health care. They were very interested in the cooperative movement. Health maintenance organizations or HMOs weren't really around back then either, and it was very grassroots where some consumers really wanted a different way to deliver health care in an efficient manner. They thought consumers should really have a say in both the delivery and cost of health care. And even back in the early 70s, there was complaining about the cost of health care. Imagine the way it is today. So on March 1st of 1976, we actually saw our first patient. So a lot of those values that you see in the history books we are actually doing in our vision and our mission today as well. So over 43 years, we haven't really changed a whole lot. Certainly, the landscape of healthcare and health insurance has changed, but we've pretty much have stuck with our values, our mission, and our vision, and so forth.
Well, I wasn't aware of that whole story, and it makes me like you guys even more. So that's pretty cool. I love that. When we talk about not just the history of GHC, but the history of healthcare and how it's changed. I mean, I'm sure there's plenty of things you could speak to, Mike, about that. But growing up as that small entity and growing up right here in this community, then as you looked at affiliations at groups to get involved with, like Dane by Local, was that really important for GHC to kind of maintain that as you kind of continued to grow into the future?
Yeah, I think being a part of area and local groups and affiliations like Dane by Local, like local chambers of commerce, being able to be an expert and an advocate for those same type of companies that we serve. We serve a very large number of small businesses, but we do cover many large businesses too, like the federal government, the state of Wisconsin. But when you get outside of those government programs, the average size of our company population as far as our customers is probably less than 10 employees. So we have a very big connection to organizations like Dane by Local because of our expertise in helping those types of businesses.
Now, before I go any further, I should explain. Okay, so we know you're both with Group Health Cooperative, but can you identify and tell us what you do and what your role is here? So, Mike, go ahead, and then we'll get to Emily.
Sure. I'm a group sales consultant, so I mainly work with insurance agents who are many times the intermediaries between our companies that we work with and they act as their expert local advocate, and they have access to many different insurance products and carriers, so that's why they typically have the relationship with the companies because they manage all their insurance needs, whether it's health, dental, vision, multitude of insurance products. But I work with those agents in putting health plans together for small businesses and so new businesses. And then we currently have about 800 accounts on the books that I help support in that as well.
And Emily, what about you? What's your role here at GHC?
I'm a marketing and public relations coordinator in the marketing department. I work a lot with the sales team to develop materials that they use with agents and potential groups. I also handle a lot of the charitable giving along with Kate McLaughlin. So that's a big part of our role, being community involved here at GHC. We spend a lot of our time out in the community at different events and marketing GHC and putting a face to the name. And it's a pretty large part of my role. And I get to be involved in Dane by Local and a lot of the chambers and local organizations.
We've done some fun things with you guys here in recent years as well, and we'll talk a little bit more about that in just a minute. But talk about the difficulty of marketing these services in this organization when it's kind of something that people think maybe shouldn't be marketed sometimes.
All the healthcare you get in Madison is great, and that makes it difficult. But we have a lot of things that are unique about GHC that a lot of other people don't offer. So we kind of have that advantage. We can market those things to people, and it appeals to the local community because we're a local organization, and we have all of these ties. And there are a lot of things that we're able to capitalize on that others aren't. And I also think the education piece is really important. As Mike mentioned, healthcare is ever-changing, so we like to do whatever we can so the public can make informed choices and know what's going on in the difficult landscape that we're living in.
Mike, what makes Group Health Cooperative different than other area healthcare providers around the Madison area? Because we know a lot of them are great, but what makes GHC so unique?
Sure. We actually have a lot of things that are actually different, but I'll try to focus on some major ones.
All right, maybe that's too big of a question.
Well,
that's better questions,
Loaded
Jason.
question.
Yeah, loaded question.
Okay, sorry.
But just the way we're organized, we're a member-owned nonprofit cooperative, so how we're governed is just totally different. There aren't too many of these types of organizations in the country. So just the way we're set up in that regard. As I mentioned earlier, in our history, we were formed by consumers, and the owners of GHC are our members. All of our board of directors are members of GHC, so the major decisions of how we are run are they're affecting their own health care, health insurance. So, and that kind of rolls into we're also kind of a company that's under one roof. We not only manage the healthcare, we have 6 of our own primary care clinics, but we run the insurance operations as well. So we're what we call under one roof. We have a more of a seamless way to deliver healthcare. We certainly work with our hospital partners and specialty groups too, but we are primary care focused, so we own and operate 6 of our own clinics. We have control over that care, way of managing costs, and that's just a really big difference of how care is delivered elsewhere in the area.
I think that's amazing, and I mean, wouldn't it have been easier to just pick one or the other, do the insurance or do the healthcare, mm-hmm. right? I mean,
right.
Yeah, so
exactly.
The fact that you do both is more challenging for you as an organization, but I think as a GHC member myself, that makes it that much easier on members and your patients to have that central hub for all those things. It makes it easier for us, and I think applaud you guys for that.
Mm-hmm. Mm-hmm.
Better together.
Marketing over here. See that? See how that works?
And with our primary care and controlling those things too, we have what we call same-day appointment access too, where you can actually get into your provider quicker, many times the same day, whether it's your provider or your provider's team. Our clinics are encompassed by teams of doctors, so they work together sort of like on a small practice. And you're just able to access them a lot quicker. So,
one other thing I love about GHC is that you do put an emphasis on complementary medicine and then other alternative sources rather than just the straight Western medicine. And I think that's something that a lot of people, especially in this area, are looking for. But as we learn more and more about medications and our bodies and just everything that's affecting us and our health, those alternative sources, I think, are highly important. Why was that so important to have that be a big piece of Group Health Cooperative?
At GHC, we kind of want to treat the whole person and not just the disease or the illness or the ailment. So we were the first in the area to add this complementary medicine program that's actually a part of your benefits. And they've just kind of grown and expanded, and we've been adding new services. So at some of our clinics, you can get massage, aromatherapy, Reiki, reflexology, myofascial release. There's so many options, and then there's also those group classes. And I also want to add that that's not something just for GHC members. Anyone can come and access these services at a rate. So it's open to the public, and it's a great service.
I love it. Use chiropractic. We use some of the other services, and I think it just adds so much to our healthcare, but it also is a big benefit to us as individuals, as human beings, as we don't want to always just say, let's throw another medication at this ailment. And so, I applaud you guys for that as well. I think it's fantastic. Mike, anything to add there?
Yeah, just one other detail that I think is very beneficial is, our doctors support it. So they're actually, even though you don't need a referral, they refer out to those types of providers to help the healing process in certain conditions. And when that's done, that also gets into their electronic medical records. So they're working together, knowing what's happening with your body, your illnesses, your injuries, and they're working together versus just having another complementary medicine or alternative provider in the community working with you, and it's just not getting back to your primary doctor. So we really look at using your primary care doctor as part of your teammate on your healthcare team, so you're all working together on all your care, and not just bits and pieces, and keeping it all together.
That's another, I think, again, convenience benefit for members is that a lot of these things are at the GHC clinics, right? So you don't have to set up an appointment with another off-site location and then go to that and then run here and there and all of that sort of stuff just to get some of that complementary medicine service. So I think that's fantastic too. All right, now I need to talk to you and ask you both, and you can both chime in on this. What is this crazy idea about a satisfaction guarantee that you recently implemented? When I heard that, I was thinking, in healthcare, wow, that's got to be tough to meet. So what spurred that on?
So it's called the GHC Experience Guarantee. It's part of the Smart Care that you receive at Group Health. So you can go, if you're at any of our 6 clinics and you are not satisfied with any part of your service, you can download our app at ghcsmartcare.com. And you can tell us a little bit more, and then someone from member services will call you to kind of gather some information so we can improve from your visit. And then you can tell us how much you feel you should pay for your visit, and you can be refunded for your total out-of-pocket cost up to $2,000. So if you felt that your visit was worth $15, $20, whatever it may be, you tell us. And
free.
Yeah, or free.
Wow. Okay, Mike, how does this work? I understand now from Emily about what it is. How does this work for an organization to do this?
Well, because we feel we provide very good, impeccable service and great care to our members, we're just backing it up with our pocketbooks. And it not only, as Emily mentions, it gives us an idea of where we are not providing the service we expect ourselves to give, and it just will only enhance improvements and so forth. We did borrow this idea from one other organization in the country, not in our area, but so we're not the first to do it, but it worked very well with them, and so far so good. It's been working with us. On that a Smart Care app, you can actually provide compliments as well, and we've gotten compliments through it too.
Yep.
So, and we have a certain amount budgeted, and we're well short of what we expected to be potentially paying out. And just to put another kind of note on it, though, a lot of our members do have benefits that do have lower copays. So to get to that $2,000 is sometimes pretty hard because you might only have a $20 or $30 or $40 copay, and that's all we're refunding. So in reality, it may or may not be a lot of money, but it's their money, it's their consumers' money, and it gives them the chance to tell us what that visit was worth.
Have you found, or have you had any feedback from members about how they felt? Did it make them feel any differently about GHC that you then implemented this new response to people with complaints?
I think so. We've actually had people come and make a suggestion on the app or offer some kind of advice and not actually ask for the money back. So they just like that they can have even more of a voice in their cooperative, and I think that gives them the chance. So far, so good.
Yeah, I mean, I would just assume that would make people feel good about being a GHC member, and feel even better about it. So, I think it's, even though, like you said, you're kind of stepping out there, taking a bit of a risk in a way, you feel good about the services you provide, the quality's there, and why not? I think it's incredible. So love it. Okay, Emily, talk to us a little bit about how important it has been for Group Health Cooperative, because we're going to get back more into some of your giving back. Why is it so important for you guys to be involved in the community, to give back into it? Because you're a nonprofit yourself, right? So most nonprofits aren't that active in giving money out to other people because we're nonprofits, but you guys do a lot of it.
Yep, one of our common values at GHC is to be community involved, and it's always been a huge part of what we do here. We have some values that we try and align our charitable giving with, and we like to stay local right here in Dane County and make a direct impact on the people in our backyard, because it directly impacts the healthcare of Dane County. So it's huge. It's a large part of my day is spent focused on how we can give back in a way that's going to benefit Madison as a whole. One great example is Project Home.
I had no idea that would come up. None at all.
We've been partnering a lot with Project Home over the past 2 years, and it's been great because what you're doing is literally helping people's health care, and may not seem like a direct impact, but that it all goes full circle. So
I actually didn't. There was no plant. I had hoped that we'd go that direction, but no plant there. No, it is really something that is not always easily transferable and tied together about Project Home's work. And I'm the outreach manager at Project Home, if you didn't know that. But anyway, so is that, again, we're making health and safety improvements within a house, and everybody thinks that's great for the house and maybe the neighborhood. It's also great for the community, but it's really great for the people that live in that house because we are preventing falls. We are improving their indoor air quality. We're making that a safer, healthier house to be in. And as a result, they are healthier individuals. And so then insurance companies and healthcare providers aren't seeing them as often. And those are all really, really good things, and they all tie together. So I appreciate your vision here at GHC to see how that works with what we do. But we also get to have some fun, right? Like we did some fun things last year, and I'm looking forward to what's coming up this year. So tell these people here, because I know, hopefully Mike knows, that what we've got coming up this year and what we're thinking about doing again.
So last year we partnered with the Mallards at GHC, and part of that partnership allowed us to select a nonprofit in the area that would benefit from the partnership. So every home run the Mallards hit, GHC donates $100 to Project Home. And we've selected them again for this year, so come out to some games this year and support. Last year we also hosted a home run derby with the Project Home staff, which was awesome. And GHC donated some money for every home run that Project Home hit. Had to adjust a little bit. They didn't hit the ball as far as we anticipated.
And I will tell you, so we were talking about that idea and setting it up, and I brought it up as a possibility at a staff meeting, and I work with a lot of these big guys, and they're muscular, a lot larger than me. But at first, of course, I got a lot of strange looks, like what are we doing? Is this someone's going to let us do this? Like, who would do that? Well, GHC would. That's great, and the Mallards, fantastic. But then I had all these guys. Oh yeah, I'm gonna, like all this macho talk about how many home runs they're going to hit, how far they're going to hit it, all this sort of stuff. And when they actually got into it. And I didn't know what to expect. I mean, I haven't played baseball in forever. I didn't know if any of these people played baseball that I work with. We certainly don't have a Project Home team that's active anywhere in the community playing baseball anyway. And the results were not quite as good as we were thinking. And so Emily and GHC quickly adjusted and said, okay, let's say if we get it to this point, we're going to call it
let's just get it out of
this
the
amount.
infield.
Well, and then we had to drop the expectations a little further there. Let's get it out of the infield. Hey, we'll give you something if you can hit it out of the infield on the fly. Fantastic. So it was a modified version, modified rules, but it was still a lot of fun, and I think we got better as we went along. Don't you think? Yeah.
Oh, yeah.
I think we got better as we went along. And I've already been talking to our staff about hitting the batting cages early this time, so we are a little more tuned up for that event. But Mike, there are rumors that you can swing a mean bat, and that you might be there this year. Is that going to happen?
That is a rumor.
Yeah, I think it's
but
just
I
a
could
rumor.
Be there. But as far as swinging a good bat, but I could be there.
Okay.
I'll work on that.
All right.
I'll go to the batting cage beforehand with you, though. So
Good.
I'm getting older, so I don't want to throw out a shoulder or something.
Well, that's true. We do. It's important to stretch first. What else? So you guys should give the people the advice. What should we do so we don't injure ourselves and end up at one of your clinics?
We'll
what should
have
we do before
complementary medicine there
Okay.
on site.
Maybe I talk to a physical therapist beforehand.
Okay, good. Some good advice there. So we've got that. And then, of course, Group Health Cooperative joined on as partners with us for a couple of our other big volunteer events at Project Home. One of them being our Hammer with a Heart event and also Paint-a-thon. And we had a really good time working with your team. So I hope you guys enjoyed that as well. And it looks like we're going to do it again this year, too. Right?
Yeah. We had a great time last year.
What was some of the feedback from staff about that? Because I don't know how many of them ever worked on homes before, or I know one person I gave a drill to start doing something with, and she looked like she probably never held a drill in her life. What was some of the feedback from staff about that experience?
It was awesome. As soon as it was over, everyone was ready to sign up for Paint-a-thon. Everyone took a lot of great photos. I got a lot of great emails after the fact saying that it was a great opportunity and they were glad that we took the initiative to do something like that this year. One highlight was the lady's house that we worked on. Her American flag that she had hanging was all tattered, and one of our GHC employees went out and bought a new flag and they hung it up for her at her house, and it almost brought the lady to tears, and that's something that I think all of our staff will remember.
It was a great moment and a great way to give back. And that's what it's all about. The other thing that I will remember, and especially since she's not here, we can put this out there, is that I had talked to Kate, who was on site, about raking back some of the landscaping stones. And she grabbed a leaf rake, first off, not a garden rake. And then secondly, she had it upside down. So the teeth of the rake were actually faced up, and I gave her that job for a while, and then I went somewhere else, and I said, "How's Kate doing?" And I kind of looked around. She was still in the same spot, and I'm like, "Kate, you're not going to get very far with the teeth sticking up, and you actually should be using a garden rake. Here, let me introduce you to a garden rake." So I think that may have been the first time she had raked.
She owns a house now, so I'm sure she appreciated the advice.
See, you can learn stuff by volunteering with Project Home too, and learn a lot of stuff from GHC. As we look to the future, guys, and I want to bring it back to you now, what do you see as 2019, 2020? What are the goals for this organization as we move into the future?
I think many of the strategic goals, I think, have to do with partnering more with employers and listening and being viewed as partners versus just a provider of insurance or medical care. If we can meet and talk to them and what's important to them, what's important to their employees, how can we so-called bend the healthcare curve together with certain ideas, whether it's wellness, whether it's, just being more educated about how to access and deliver healthcare, telemedicine, those sort of things, innovative kind of electronic medical records, utilizing that data to better serve a bigger population. That's kind of what seems to be kind of on the near horizon on trying to improve those types of things.
And Emily, as you look for partnerships moving forward too, kind of on the giving back side. What kind of things are you looking forward to in this year and beyond? Like, what are the goals for GHC on that front?
We're always looking for new things that we can sponsor that are more programmatic, where either we can get out there with our staff or we can spend a whole day with a certain population where we feel like we're helping make a difference. And we're always looking for new ideas like home run derbies or new engaging things that we can bring to our staff and bring to the community.
Now, we're excited about that home run derby this year. I just had a new idea this morning.
Of course.
I don't know if I can debut it here. I've got to cover my bases and see if it actually there's a possibility of it. But there might be something added.
Cover your bases.
More to come.
Wow, that was great baseball analogy. I didn't even plan that. That was all natural, just like everything with me. Okay. Anyway, now we have a new segment for this podcast that I wanted to introduce. It's going to be the lightning round question and answer Q&A. It's all about local. It's all about some local organization group that you see in a positive manner, and there's only one piece to this questioning that doesn't fit that line, but it was more of my personal kind of inquisitiveness there. Okay, so Mike, we'll start with you. Give me a restaurant.
Yola's.
Emily, restaurant.
Charlie's on Main.
What about a local festival? Emily.
Bratfest.
Mike. I gave you more time that time, Mike. Come on.
I was going to say Bratfest.
It's a great festival.
Okay, Bratfest.
Can be the same. You don't have to pick different ones.
Blues
That's
Cruise.
Oh, I love it. Okay. Blues Cruise this year newly benefiting Dane by Local as well. So look for that in this summer of 2019. Okay, a view or site? Your favorite? Give me this one. Your favorite? A view or site?
When you're coming around John Nolan Drive and you can see the Capitol, that would be mine.
That's a great one. View of Lake Mendota from Memorial Union with the sunset.
What about a coffee place or establishment?
Mine would be Yola's. Repeat, but.
Tuvalu in Verona.
How about a nonprofit?
Besides GHC?
Or Project Home.
Can be GHC. We talked
Dane
about
by
us.
Local.
Okay. Mike?
Verona Area Needs Network.
This one, what's your favorite street name?
Crazy Legs.
Mike?
Oh, that's a good one. Kind of boring, but State Street. It's more of the vibe than it is the name of the actual street name.
Good sound reasoning. Okay, the last thing that does not fit at all. Your favorite utensil. Your utensil of choice. Mike?
Certainly not a chopstick, so I will say spork.
Oh, come on.
You can. It does not have to be exclusive here. You can pick a spork as well.
All right, spork.
Spork.
Or chopsticks. I do like sushi.
I like a large fork. Like I can't stand those little tiny skinny forks or really short tooth forks. Give me a big fork that I can put some food on, right? Like, why do I want to? I don't know. Anyway, wait. I'm sure my healthcare provider would tell me to take smaller bites. That's really important. Is there anything else, you guys, before we sign off, that we really need to know about GHC and your connection to Dane by Local and all the great things you do around Madison? This is the open-ended question.
I would just have to say, just more of a serious note. We do all these really good things to provide good quality health care, but we're also evaluated nationally, and we end up getting very high rankings from these national organizations, and we do it because that's what we do. But it's nice to have the accolades, to have the proof that say from the professionals that say that we are the one of the best health plans in the country and the best in the state of Wisconsin. So it's more of a, we don't do these things to get those awards and recognitions, but we feel that it's kind of a icing on the cake, especially in a market where we do have good health care, good health insurance in Dane County.
I would say that is well-deserved results and praise for this organization. So thanks to Mike Polk, Emily Scare of Group Health Cooperative of South Central Wisconsin. This is episode 2 of Let's Get Local. We'll be back next month with, I don't know, we'll find out. Catch you then. Thanks.
Thank you for checking out Dane by Local's new podcast, Let's Get Local, available on YouTube, Facebook, and DBL's website. Join us next month for more local talk.